I can now say good evening and welcome to the first Primary Care for All Americans Zoom. My name is Michael Fine. I'm the president and board chair of Primary Care for All Americans, and we are truly excited to have you with us. We're here together to create this movement to build a healthcare system for the United States that's for people, not for profit, and starts by providing primary care, again, to every single American in every neighborhood and every community all across the country. I've done a lot of public health in my life. I've done a lot of primary care in my life. But the thing I know from a public health perspective, the thing I know from a public health perspective is the way we're going to get the best health outcomes is when every single American has primary care. This first Zoom is a critical part of our organizing strategy. We'll use these Zooms to bring people together, to help people understand that this is a doable thing, that it's not only doable, but we can do it together and make it exciting and fun as we learn about how people can work together to provide basic health care for one another. And in the process, how we build a healthcare system for the United States that's for people, not for profit out of that work. Those of you on this first Zoom are our colleagues and friends. We want to thank you particularly for being here, and thank you in advance for your comments and ideas. These Zooms are designed to bring people together. Please click the chat to fill out a brief survey at the end of the meeting. Your comments and suggestions will help us make these Zooms better and help us build this movement. Many thanks in advance to the team of people who've been working over many months to produce these Zooms, to Doctors Aliyah Shafi, Donna Smalls, Gabrielle Yaru, and Alan Roth, who are leaders and heroes, to John Wright for engineering, and to Brian Kaiser for production and coordinating. Now I'm pleased to introduce our amazing MC for the evening, Dr. Gabrielle Yaru of Jamaica General Hospital in Queens, New York.
Thank you, and good evening, everyone. Thank you all for joining us on this very exciting meeting. We are happy to introduce PC4AA, Primary Care for All Americans. We are building a movement to provide healthcare for all people. Healthcare for people, not for profit, in every neighborhood and community. If you have questions, please put them in the chat and we'll try to get them answered in a few minutes. Now we'll hear from 3 individuals who will tell us about their experiences with primary care in our current healthcare system. And we'll start with Zaria Jones.
Hi, my name is Zaria Jones. I'm from Queens, New York. I believe healthcare is important and begins with primary care. I have a great relationship with my primary care doctor, which makes it so much easier for me to follow up with appointments regularly. However, this isn't true for everyone. Tons of Americans either don't have health insurance or can't afford regular checkups. I believe primary care for all Americans will improve the accessibility, availability, and affordability of healthcare, which is the first step towards achieving optimal health and well-being. This is why I'm a supporter of this movement and believer of this movement. No more surprise medical bills, no more high insurance premiums, no more treatment or medication denials. The time to start caring for the population begins now with all of us.
Muted. Gabrielle, you're muted.
Sorry. Thank you so much, Zaria. And now we'll hear from Shania Prasad.
Hi, my name is Shania Prasad and I'm from Queens, New York. I believe our healthcare system is faced by many challenges affecting healthcare seekers such as myself. While there has been a growing demand for healthcare services, I found myself struggling to find a primary care doctor. Many Americans are either uninsured or underinsured, making it harder for them to access medical care when they need it the most. I myself have found it difficult to find a primary care provider who accepts my insurance coverage, let alone new patients. I believe primary care for all Americans will not only improve our broken system, but also create transparency for underserved populations. This movement is a step toward accessible and affordable healthcare right within our reach.
Thank you so much, Shania. Now we'll hear from Twyla McInnes.
Hello, I'm Twyla McInnes, and I'm representing the nursing profession. My career is focused on value-based healthcare and population health. This centers on improving patient outcomes and also driving down healthcare costs. This includes finding ways to reduce unnecessary emergency room visits and unnecessary readmissions to hospitals. This work cannot be accomplished without every American being attributed to a primary care provider. The primary care provider knows the total person. They know the social determinants of health, such as the lack of housing or lack of access to nutritious foods. They know their behavioral health needs. They know their chronic conditions and the need for specialists. Primary care providers put the total picture together of every person. And that's why I stand behind the need for primary care for all Americans.
Thank you so much, Twyla, for your thoughts and experiences. And thank you as well to Shania and Zaria. So now we are pleased to introduce our distinguished speaker, Dr. Lynn P. Blanchette. She's a board-certified community and public health nurse in practice for almost 40 years. She is currently an associate professor in the Zvart Onanian School of Nursing at Rhode Island College. Her clinical interests are population-focused nursing care, primary health, particularly on expanding the role of nursing in primary care. She is the vice president of the Scituate Health Alliance, where she works collaboratively with the town nurse to deliver health services to the community in Scituate, Rhode Island. She will be sharing with us how tiny Scituate, Rhode Island has made quality primary care available to all their residents. Dr. Blanchette.
Hi, thank you for the introduction and happy to be here with all of you this evening to share what we hope you will see is a bit of a success story for primary care at the population level. So I'm here to share our success story with you. Tiny Scituate, Rhode Island is a small place in the northwest corner of Rhode Island. And it is the only place outside of a U.S. military base or a Native American reservation where every resident is able to have access to primary care. We are the town of 10,000 people where we are known for the state's largest municipal reservoir and a fall art festival. We are also known for being the most Republican town in Rhode Island. So I'm going to share how a small committee of our local town council back in 2000 was charged with finding a less expensive option for providing health care for its town employees. That committee was called the Health Plan Committee, and it was made up of several town council members, a local family practice physician who may or may not be part of this movement, and some town residents. So after quite a bit of investigation into possible options for solving the problem around very expensive health insurance for municipal employees, suggested an approach that included the use of medical savings accounts, which at the time proved not to actually be an accessible option. They ran into challenges with being a small group. So, but what did become apparent at the time was that though there was an option to explore the use of primary care as a driver of health for all of the citizens of the community. So offering population-based primary care open to everyone in the community could provide all of the residents of Scituate with access to primary care. That, partnered with a medical savings account and a high deductible insurance plan, would offer exactly what was needed. So the health plan went through several attempts at developing and having a high deductible insurance plan available to a small group, but that didn't work out so well. So the committee became a 501c, called themselves the Scituate Health Alliance. But again, they faced these hurdles of not really being able to find any insurance company that would underwrite the high cost, and the medical savings accounts were too complicated. But what the committee did do was to find funds in the community to help everyone in Scituate get connected with a primary care provider. So we know that people who have a regular place to get care, as people have mentioned here tonight, have better health outcomes and a better quality of life. When I joined the team, we decided that we really needed to do some community outreach to even understand how many people in our community did not have access to primary care, either because they were uninsured or underinsured. Remember, this is before the Affordable Care Act passed, so we're talking about the year 2000 or so. And so what we did was hold a seasonal flu clinic. So we utilized a vaccine from the health department in Rhode Island to offer a free clinic, and we didn't bill any insurance companies for the immunizations. And we really asked people if they were insured or not. And then once we identified people who were not insured, we offered them access to primary medical care through a voucher system. We partnered with primary care providers in the community. We paid them an annual fee to offer annual physical and sick visits with a small copay. The first few years that we used this approach, we identified more than 250 people in our community who needed access. They were the recipients of those medical vouchers, and they had no out-of-pocket cost for access to primary medical care. We eventually added primary dental care and partnered with dentists in the community using the same sort of voucher system. Then we expanded the way that we thought about primary care and really focused on opportunities in the community to identify some health resources that were available to people, to potentially expand those resources, and we did a lot of community health education. We created a position for a nurse, which the model is called the town nurse. And so that nurse is really positioned to partner with our clinical partners as well as community members. So she partners with school nurses and the folks at the library to provide community health education. She goes to the senior center on a regular basis and then just meets with our local residents wherever they are. Eventually, we were able to partner with a federally qualified health center in Rhode Island called Well One, and we built a primary healthcare center, which we call the Neighborhood Health Station. At the Neighborhood Health Station, we bring clinical primary care together with our population-based primary care. Our town nurse provides the community-based primary health education, outreach, and support. And every semester, nursing students are part of this experience, which also expands the number of healthcare providers who are part of this movement and really understand the benefit of primary care. So how does that strengthen us as a community? We have neighbors talking to neighbors about needs and resources in the community, and we develop local Scituate-focused interventions. We think we're improving the public health in Scituate, though we don't really have a measure of that, but we build services in Scituate. People get their medical care here instead of having to leave town, which strengthens us as a community. For example, we know a lot about our new moms and babies because we've been able to access statewide health department data, and it tells us a lot of information that we can know, and we can create programming and interventions at the local level. One great example, too, is how we partnered with our clinical side. The primary care physician there told us that we had a high rate of tick-borne illness in our community. And so now, to support the community, we distribute tick tubes. We do community health education programs, and we've brought in local experts to help people know when they should seek treatment after a tick bite. So our experience teaches us that all communities can do what we did and provide primary care to all. It'll look different in different places, but nothing can replace the ability of a motivated group of people looking out for their own families and neighbors. I hope you take a few minutes this evening to ask me some questions, and I'm happy to give more examples or tell some more stories about what we're doing when that part of the program comes around.
Okay. Thank you so much, Dr. Blanchette, for those inspiring words. We will get to questions in a moment, but first, let me introduce Doctors Aaliyah Shafi and Donna Smales, my colleagues at Jamaica Hospital Medical Center in Queens. Dr. Shafi?
And primary care is about relationships. someone who knows you, your family, the community, someone you can trust.
When everyone has primary care, communities are healthier because we can prevent disease.
When everyone has primary care, we'll spend far less money on healthcare as a nation. There'll be more money for public housing, safe housing, public transportation, the things that matter most for health.
We mean everyone. When everyone has primary care, and when communities are getting primary care from doctors and nurses who are part of the communities they serve, the health of all people improves and improves together. We aim to ensure all persons receive equal health care and get equal health regardless of where they live, how much they earn, what communities they come from, or what they look like.
We thank everyone for attending this Zoom call. We're that much closer to bringing primary care to all because of you guys. We can build a healthcare system that is for people, not for profit. And yes, we can provide primary care to all Americans in every neighborhood and community. Now, Brian Kaiser will share some of the questions from the chat. Brian Kaiser.
Thank you. So anyone who has any questions, please post them in the chat. We have a few minutes, so hopefully we will get some good back and forth here. I want to start with a question that I think weighs heavily on the minds of everyone who is not from the Northeast. What is a tick tube?
Oh, I'm happy to describe those. Yeah, it is this amazing product that you can replicate or purchase, but it is essentially the toilet paper tube, cardboard tube, covered in some waterproof covering, and it is stuffed full of permethrin-soaked cotton balls. Permethrin kills ticks. So if we put the cotton balls out in our stone walls and in our wood piles and along our foundations, then the tiny little rodents who carry the ticks around up here in the Northeast, they carry the little cotton ball stuff back to their nests and kill the ticks. So we reduce the number of ticks in our community by putting these out in our backyards, and so there's less likelihood that you're going to get a tick bite. So very upstream ways of delivering primary care. Prevention, prevention, prevention.
Yeah.
Yeah.
Okay, Eliana has a question. She said, who pays for the vouchers? It would make sense for insurance companies to be interested because illness gets caught earlier. Not only is the patient better, but the overall cost is much less. And I think this is going to lead to more questions about the role of insurance companies in all of this.
We would be thrilled if insurance companies wanted to pay. On the other hand, what we are really excited about is that our town council has committed financial resources to its community members. So they actually fund us at the Scituate Health Alliance to cover the cost of the voucher and for hiring the town nurse.
Okay, great.
Yeah.
Bruce Phillips has a question that I think might be better read by him than by me. Bruce, can you unmute yourself and ask your question?
Sure. I wanted to know if you had primary care doctors in Scituate enough to add the 250 patients, because there's a big problem around here and up in Massachusetts that I know of, that where I practiced for 36 years, they're just not being primary care doctors now.
Mm-hmm. It's a really interesting question. We did not have access to enough primary care, not just doctors, but other primary care providers. It was an interesting thing. Many of the people that we provided the voucher for originally held on to it. And some percentage of them kept it and used it when they had a need for a sick visit. And some people never used it at all. So sort of like the way most Americans use their health insurance card right now, right? Even when they have one, they don't always access primary care resources, right? You very often wait till the problem has gotten to the point where you need something higher level than primary care. If you're lucky enough to have a primary care provider, then maybe you get a sick visit, which always is, costs more. So, but we were able to identify primary care providers in nearby communities. And then, as I said, eventually the federally qualified health center that was sort of in a neighboring community actually built a health center in Scituate as a result of this partnership. So we definitely brought primary care to Scituate as a result of our efforts.
All right, thanks, Bruce. Jeffrey asks, are the physicians and clinical staff salaried?
So I'm guessing you mean the folks who take our vouchers? Yeah, because we
I'm
don't
guessing the question is, one answer is that the physicians aren't salaried, right? So you can explain how they're paid.
No.
Then you have the nurse and others maybe who are salaried.
Yeah, so the primary care providers we use either have their own primary care practice or are employed by the federally qualified health center. So we don't directly employ any of the primary care providers. We reimburse them for the care that they provide to the people who are our Scituate residents who apply for our dental access or medical access. Yeah.
And how much do you pay them?
We pay them right now $450 a year.
Okay, so they get a flat amount per patient per year.
Right. Yep.
Great.
And that went up from, we were at $350 for a very long time. Yeah, that was the original number that Dr. Fine helped us to develop. And we just recently thought we would do a little catch up. So, yeah.
Did the town of Scituate have to raise taxes to make this happen?
No, it's actually a very small amount. I mean, it's about $15,000 a year that they give us for a budget.
Oh, wow.
Yeah.
But for other communities that might have larger populations, the per capita amount of $450, does that include the cost of building the health center? No,
no, the federally qualified health center took on the cost of moving and, locating in the community.
Oh, great.
Yeah.
Okay. All right. So Tracy asks, how is success being measured?
That's a really good question. We're measuring success through community interaction right now, right? We're sort of counting the number of people who attend the events. We're tracking the number of vaccines that we administer. We are, sort of noticing how many people take up our tick tubes at our fair in the spring and summer sort of months. But yeah, and, the number of people who use our voucher system and actually get, go and access healthcare. So I think, that is our next step. I think we've been really busy building this system and utilizing some resources, but I think that is the next big question, right? What does success actually look like, and how would we measure it? So if you have any idea of how we should measure it, please feel free to share it with Michael or I.
Yeah, I believe Gregory probably has some ideas. He's asking, can you tell us how the group got started? Which I think you addressed vaguely, but what can we do to replicate the model? Is a small community essential for this approach to work?
I think if you think about small groups of people, that could be a neighborhood, that could be a census tract, right? Rather than thinking about, we happen to have a geographically identified town that had a really nice denominator of 10,641 or so. And so that number seems to have been pretty manageable for the small group that we have. But when I think about where we started in 2000 with a group of people who were really trying to think about how to solve a small town's dilemma around continuing to offer access to healthcare for its municipal employees, to now actually having a primary care center located in our community that serves, well over about 20% or so of our community. So, yeah, I think it is going to be different wherever you are. So your small group in your geographic area is going to have to build this in a way that works for that community.
Yeah, that's a great point.
Yeah, good question. People still uninsured.
Sorry about that. Flo asks, with the Affordable Care Act available to the population, why are people still uninsured. Maybe that's a whole separate webinar.
Yeah.
But
And it certainly expanded the number of people who have access to insurance. Absolutely, right? We saw our numbers drop from 250 originally down to a annual number of that runs somewhere around 30 or 35 people. So we don't have 250 people anymore, at least not that we've been able to find. But we do have people who are in job transitions, who are, close to Medicare age. That seems to be the primary reason why people are not doing it. They are just not either comfortable getting up into their, looking for an insurance plan, Health Source RI, here in Rhode Island, or maybe they just see it as a very short-term need and they're going to wait and be uninsured for a little while. People worry they won't have access to their same provider, depending on which insurance company they get. We've also heard that, right? But my provider doesn't take that one. Yeah, right. And affordable care is not always affordable for everybody. Yeah, so
that leads well into another question from Eliana. Does this mean people get a primary care doctor that they see most of the time so they get to know them?
Mm-hmm. Oh yeah, you still pick your primary care provider. Absolutely. If you already are with the provider and your provider will agree to accept our voucher as payment for the care that they provide, we'll pay anybody. We have a set of people who've already agreed, and the Federally Qualified Health Center certainly has primary care providers, and they accept the vouchers for medical and dental care. But if you're already associated with somebody, then they will absolutely, we will absolutely pay them if they're willing to participate.
Okay. I think that's about all the time we have. Sorry, a couple questions just popped up.
Yeah.
Thinking about sustainability, which your group seems to be successful, what would prevent a hospital system from merging purchasing, taking over? That might be too big a question to answer in a
yeah. Could I just, I mean, maybe just put one more thing out there for people to think about. It is this alignment of our neighborhood health station, which includes the population focus, the town nurse primarily as the model of that, and our clinical partners, right? That coming together to say, I see something happening in this primary care practice, and can you go out into the community and help prevent it, help reduce that risk, help really bring more people in to get treatment when they need to get treatment, get them health information about how they can protect themselves, right? Because the primary care provider who's in the Federally Qualified Health Center can't go out and do that. And they need a partner who's in the community, really reaching out, meeting people, hearing what's going on. And then they need to have someone who has the skill set to respond to that. And so, I'm like Twyla, going to be a big advocate for nursing to be considered to have a bigger role in primary care in all of the settings, those that are community-based, external to the clinical settings and inside the clinical settings, because we're part of the team.
Community health workers are an important part of this.
Yeah, we do have an organization that we're partnering with fairly recently that has come to town, and they have lots of primary care community health workers that they're going to bring into town to help us. Yep.
And can I just add one tiny thing?
Yeah.
And that is no hospital system and no venture capital company can buy a committee of local residents who were working together for 25 years to take care of their own community. We are not for sale.
Okay, I think that's a good note to end this part on. Dr. Yaru.
Okay, thank you. We encourage everyone to bring someone new they think would want to get involved in this amazing movement to our next Zoom meeting. This was a great meeting. We had lots of questions and it's very exciting. So we'd want to spread the word and have people come in and join. We'll be announcing the date and the time of that Zoom very soon. And please go on our website, primarycareforallamericans.org. We want to let you know about a couple of our upcoming speakers. Rishika Fernandopoul, MD, the founder of Iora Health, will be speaking in January. And in February, Wayne Altman, MD, chair of the Department of Family Medicine at Tufts, will be speaking on the PC4U legislation in Massachusetts. Hit join us if you haven't already, and give us your email and your zip code so we can invite you to the next Zoom, or better yet, please hit volunteer to tell us how you'd like to help, or hit donate if the spirit moves you to help out with a contribution. Once again, we need and appreciate every single one of you for helping us spread our movement across the nation in order to get the change we need and you deserve. Healthcare for people, not for profit. Primary care for all Americans.
Please take a minute to fill out our survey. The link is in the chat. We would greatly appreciate any feedback. Thank you, everybody, and see you next time.